Oh, that's an old wives' tale.
So old wives' tales, things that I hear on an almost daily basis, things that I'm sure that you're familiar with, things that get handed down from generation to generation. What are some of these, and what are the ones that really may not be the most accurate? Let's talk about them. So one of the most frequent ones that I hear is that, and there's different variations of this, but getting wet is going to make me sick, right? Whether having wet hair, whether it's being wet and in the rain, whether I'm wet and then I'm in the wind, or I'm outside, with my chest uncovered, or some variation of those things. But it usually involves being wet and being cold or around the wind, and then that's going to facilitate getting sick. And I think having a discussion about how it is that we get sick is important and helpful. So remember, when we get sick, meaning a viral respiratory tract infection, it means that we've come in contact with a virus. And so that usually takes physical contact, whether that's direct contact with viral particles on a solid surface, whether that's someone sneezed and coughed and then you inhale those viral particles, or whether it's someone is previously in the area, they coughed and they sneezed, and those viral particles became suspended in the air, but it takes direct contact with those viral particles, usually on a mucous membrane, or inhaled to then cause infection. And so just being wet, or just being wet and then wind, or being exposed to wind, is not going to do anything to impact your immune system, and is not going to really do anything to put you at increased risk for getting sick. There is some concern that being cold may decrease our immune response. There is some data to suggest that there may be some local vasoconstriction of the nose. This may impair how effective our immune response might be to exposure to a virus. There's actually some recent studies that look at that cold weather might impair release of something called extracellular vesicles, which is part of our body's immune response that might help fight an infection or help mitigate the severity of that infection. But really, those are pretty small components, and really, so being wet or having wet hair or being exposed to wet and then, or being exposed to water and then being cold, is not going to make you sick. And so, along the same vein, but sometimes thought of as a little bit differently, but I think I get a lot of parents or grandparents that will be really concerned or convinced that their child was sick because they slept under a ceiling fan, or they were exposed to too much wind in their bedroom or in an environment. And so once again, like I said, you get sick when you come in contact with with a virus, whether that's direct contact, whether that's inhalational, whether it's landing on a mucous membrane, or you touch and then inoculate yourself. And that's what it takes really to become sick with a virus. Sleeping near a fan is not going to impact your immune system. Now, increasing circulation may actually decrease your infectious risk if it's moving viral particles out of an environment. Of course, being exposed to air or to a fan may increase your exposure possibly to allergen in a certain environment, which may increase nasal congestion or eye allergy symptoms. And then if there is a lot of circulating air that may be drying to your mouth, it may be drying to your nose or drying to your eyes, which may cause some relative localized symptoms. But once again, being exposed to a ceiling fan in a bedroom or in a certain environment is not going to make you sick.
It's just an old wives' tale.
Another very common one I think that we hear very often is that running around outside barefoot, right? Being outside without your socks on is going to make you sick. And of course, once again, there's no real direct contact with a viral particle when you're outside running around in your bare feet. There's really no transmission of a virus through the feet, no impact on your immune system. But there are some things that you can contract from walking around, barefoot. There's certain fungal infections like athlete's foot. Of course, walking around in a locker room or like in a pool deck area where there may be the presence of some of those fungal infections. There's plantar warts, which you could be exposed to. There's things like toenail fungus, and of course parasites, potentially if there's a break in the skin, that might be part of that life cycle. So there are some infectious exposures with bare feet, but not a viral process. Another really common one that I will hear is families will really be very concerned about whether or not their child is effectively coughing or sneezing so that they can get rid of the mucus. So if they're sick, if they're not, they will really perseverate around teaching them how to sneeze, teaching them how to cough, because they're worried that if they don't cough and get rid of that mucus, and if they just swallow that mucus, it's going to go back to the lung. And that doesn't happen, right? So if there's mucus and they swallow it, they're just gonna get rid of it. They're gonna poop it out. It's not gonna make it back to the lung. Yes, we want kids coughing because we want them taking big breaths. We want them to eliminate that mucus from their airways, but they don't have to expel that mucus all the time. If they swallow it, if you don't catch it, if they're sneezing and they, then swallow some of it, that's okay. It's not going to make it back to the lung. They're not going to continue to be sick because of that. Another very common one that I will hear very commonly is the concern that the color of the mucus is going to dictate whether they're sick or not, right? So green mucus means that it must be a bacterial infection. And that's just not true, right? So the color of the mucus can mean a lot of different things. Often if the mucus is very clear in nature, we think about things like allergic rhinitis or just a local irritation, but it could be an early viral infection. Over time, as our immune system fights that viral infection, you're going to see some changes in color. As the body's immune system responds to the virus, you're going to see white blood cells come into the area. You're going to see some change in the nature of the mucus. It may become more opaque. That's the white blood cells coming in to help fight the infection. And then over time, as there's turnover of those white blood cells, you're going to see some change into that yellow as those white blood cells are dying off. And then over time, if things are sitting there, you may see some change even into that green color. It doesn't have to mean that there's a bacterial infection. Now, the longer that mucus sits, if it's not being cleared out in a timely manner, there is risk of a secondary bacterial infection happening. So sometimes, depending on the duration of symptoms, that discoloration and the green color of the mucus may indicate a secondary bacterial infection, but it doesn't have to. Remember, in general, most colds are going to last anywhere from about a week to about 10 days. And so if you're seeing symptoms lasting beyond that 10 days into 2 weeks, especially if there is green purulent discharge from the nose, that would be a time to talk with the doctor and to discuss symptoms. Maybe there is concern for a respiratory infection or for even a sinus infection. But just because the mucus is green does not mean that it has to have a bacterial infection. Another very common one is this concern that if I drink milk, the mucus is going to be thicker, and that really just isn't true. The drinking of any milk doesn't change the amount of mucus that we make. It doesn't change the viscosity or the nature of the mucus that we make. It may be sort of a psychological thing when we're drinking milk and it mixes with our saliva, it may change the nature, kind of coat the throat, feel thicker, and that may be where some of this comes from, but it's really just a sensation. There really is no change in mucus production or any change in mucus viscosity with drinking milk or any kind of milk exposure. There's another sort of saying that gets thrown around frequently, saying starve a cold and feed a fever, and of course that's not true either. The main thing when you're sick is you just want to focus on hydration. You want to make sure that you're staying hydrated, you're drinking liquids. You want to make sure that you're eating well, you're eating healthy, unprocessed foods. You want to try to avoid those really heavily processed foods. Just from a general health standpoint, but really you don't want to modify your diet in terms of restricting certain things or increasing certain things just in response to an infection. You want to stay hydrated and you want to eat a good, healthy, balanced diet. Another common misconception is the idea that high dose vitamin C is going to help you cure your cold, right? Now, vitamin C, there is some literature that might suggest that vitamin C or even zinc might help with immune function, right? But this is something that you want to be taking before you're sick. Once those symptoms have started, once you've started becoming sick, the likelihood of that high dose vitamin C or even that zinc really making a significant difference is minimal. There's really been some mixed studies looking at high dose vitamin C or zinc, but once again, it's more important for you to be on those types of supplements before you're sick as part of a well-balanced kind of approach to health and well-being, rather than just doing it in response after the symptoms have already started. Another thing that I'll commonly hear that might be done at home is that the grandmother or maybe the parent wants to put Vicks on the patient, but they want to put Vicks on the feet. They're convinced that putting Vicks on the feet is going to help with congestion. And so remember that Vicks chest rub, that medicine, really the fumes are designed to try to help as a vasoconstrictor, to help decrease some of the mucus production, to help with some of the symptoms. But once again, your feet are hopefully not very close to your nose. So if you're placing the Vicks on your feet, you're not going to really get any of that benefit. Potentially, depending on the patient, if they have asthma or if they have any kind of reactive airway, sometimes those odors that come from the Vicks might actually be irritating to the airway, might be overly drying or trigger more cough. But certainly putting the Vicks on the feet is not going to do anything for your symptoms.